Assalamu alaikum and very good morning to all of you. Welcome to IMR-SEAMEO Webinar Series 2025. The theme for today's webinar is the three tiny blood-sucking insects, must know. You all must know. And what we have three speakers today from Medical Entomology Unit of IMR and NIH to share and dive deeper into these topics. But before that, let me introduce myself. I'm Dr. Khadri Shahar, Head of Medical Entomology Unit, Infectious Disease Research Center of IMR of NIH, and I will be the moderator for today's session. I would like to take this opportunity to share briefly about our units, medical entomology units, and their roles in IMR. The medical entomology focuses on conducting research related to medical important insects. We designated as a WHO Collaborating Center and also WHO GLP laboratories where we are able to perform evaluation of insect control products. With decades of experience in controlling vectors of diseases such as malaria and dengue, numerous discoveries had been successfully translated from the laboratory to fields, ultimately benefiting the public. The unit also developed and commercialized several products and holds many patents. Our facility in City Alam is now equipped with modern laboratory, insectarium, arthropod containment laboratories, capable of conducting research on insect-borne diseases such as arboviruses and parasites. The current focus includes study on the vector of dengue, Zika, malaria, filariasis, and leishmaniasis. We welcome any potential collaboration for the benefit of public health in Malaysia and the world. Ladies and gentlemen, this webinar series was initiated with the aim in mind to share the knowledge, discuss topics on importance biomedical research. Before we begin the presentation, allow me to announce a few housekeeping messages from Secretariat. Will not be taking questions during the presentation, but participants may post their question using the link shared in the YouTube channel. The question and answer session will be conducted after all presentations have ended. The attendance links is also provided in the YouTube channel for those who like to receive an e-certificate attendance. Please subscribe to our National of Health Malaysia YouTube channel and click on notification whenever there is a new post. Without further ado, let me introduce our first speaker. She is Ms. Roziah Ali. Ms. Roziah Ali is a researcher officer in Medical Entomology Unit. She has been with the unit 2011 and has recently taken over a lot of cases of forensic entomology cases, while actively working on the vector of arbovirus diseases, especially Zika. However, today, Ms. Roziah will share with us her experience in handling a case study of fleas infestation and the impact of it. I will now hand it over to you, Ms. Roziah.
Thank you, Dr. Khadri, for the introduction, and big thank you to the organizers for the invitation and opportunity for me to speak today. Assalamualaikum warahmatullahi wabarakatuh and a very good morning to everyone. Today I will share insights of flea biology, their medical impact and strategies for prevention and control. So fleas is an insect that goes under the order of Siphonophthera. In Malay word we call fleas as pinjal, not kutu but pinjal. They are very small, it doesn't have wings, so they cannot fly. And fleas is a blood-feeding ectoparasite that infests a variety of hosts, primarily mammals and birds. Fleas, they have flattened bodies, and this morphology allows them to move through the fur very easy, and they also have a strong legs, and these legs make them very powerful jumpers. And globally, there are over 2,000 species, but only a few of them have a significant in medical and also veterinary importance. And because of their strong ability to jump and they have flattened bodies, this making them very highly mobile and very difficult to remove. And if you have any experience with itchy red spot on your skin, especially around your ankles and legs, it might not be just mosquito bites. It could be fleas. So if you can see from the picture, the flea bites can cause red, swollen, and extremely itchy spots on the skin. They often appear in cluster or lines, especially around the feet, ankles, and lower legs. And if you have pets, they also might be suffering from fleas. And from the image, you can see the fleas love to hiding in warm, furry areas and especially around the neck, belly, and also base of the tail. And if you see your pet is scratching aggressively, and they losing fur and also have a small red bumps on the skin, it could be a sign of the flea infestation. So for the flea life cycle, they undergo complete metamorphosis with 4 stages, and they start their life as a tiny white eggs, which they lay on the host, and usually the host is a pet or maybe wild animal, but the eggs don't stay at the host very long. Normally they will fall off into carpets, bedding, and cracks in the floor, where this time they will wait for the right condition to hatch. And once they hatch, the flea larvae will look like tiny worms. So these flea larvae, they love to avoid the light and hide in the dark and also humid places such as under the furniture and also deep in the carpet. And these larvae, they feed on the organic debris, including adult flea feces, because these adult flea feces, they contain the undigested blood. So this undigested blood, giving them the nutrient they need to grow. So after feeding, the larvae will spin into the protective cocoon. So this is the stage where we call it as a pupa stage. And this is where the things get a little bit tricky, because in this stage they can stay dormant for weeks and maybe up to several months. So this is where the stage will, the flea will emerge when they sense any movement, warmth, or any carbon dioxide. So this is the signal that the host is nearby. And finally, the adult flea will emerge from the cocoon, and they will jump into the host and start feeding immediately. So female fleas is very powerful, where they can lay hundreds of eggs and up to 500 eggs in their lifetime. So these numbers of eggs quickly leading to a full-blown infestation. So let me introduce you to the first species of flea. This is Tenocepalides felis. So Tenocepalides felis, or the cat flea, is particularly important because this is the most common flea species found on pets. And this species is also bite humans. It causes irritation and allergic reaction. It is a vector for several zoonotic diseases, making it a public health concern. Tenocepalides felis is highly prevalent in Malaysia, with studies showing a high infestation rates in cats. So the prevalence of fleas is influenced by the temperature, humidity, and environmental condition of the habitat. By relocating the infested cats or animals can also increase the infestation rates of the fleas. And next we have Tenocepalides canis. This is a dog flea species that infect dogs, but it can also bite humans and also cats. So this is the dominant flea species of dogs in some areas, including Malaysia. And how these species can affect humans and animals. These species can transmit rickettsia disease, including rickettsia typhi. It can also intermediate host for tapeworms, including Diphylidum caninum, which can also affect humans. For tapeworms, maybe we can refer to an expert in parasite unit, Ms. Nurhainis August Salim. So next we have Xenopsila chiopis. This is rat flea. It's a common flea found in Malaysia that infect rats. So this is a major vector for the bubonic plague bacterium, Yersinia pestis. And this is the most common rat rat-borne fleas in Malaysia. It's found in tropical and warm temperate environment around the world, and it is a public health concern because it can transmit disease to human through rats. So this is the picture of the Tenocephalidus canis, the dog flea, and also the Xenopsila chiopis, the rat flea. As you can see, there are very difference in the morphology at the pronatal comb and also the genital at the comb under the mouth part. Yes. Thank you, Dr. Khadri. And next, why fleas matter? So fleas are not just nuisance. They also transmit several zoonotic diseases. As I mentioned before, they can transmit plague, historically known as a Black Death, and also murine typhus, caused by the Rickettsia typhi. And beside disease, flea bites can also lead to severe itching, allergic dermatitis, and also secondary bacterial infection. So further the need for effective control measure. And while fleas are commonly associated with pets and homes, they can also infest workplace. And by infest the workplace, it can cause significant disruption. So employees can suffer from itching, allergic, and also infection that can reduce the productivity amongst the employees. So severe infestation, they can lead to temporary office closure for fumigation and also any other control methods. And business could face financial losses due to employee absence and also reputational damage. Although Malaysia does not have any plague case today, it has affected the country in the past. A famous Malaysian doctor, Dr. Wu Liante, has helped the fight of the bubonic plague in the China, and he also invented and introduced quarantine methods that are still used today. So between 1917 and 1957, Malaysia had outbreaks of disease called Black Plague, which mostly affected animals. So while Malaysia is free from the plague today, it is still present in some neighboring countries in Southeast Asia. The disease is mainly spread by fleas that live on rats carrying a Yersinia pestis bacteria, the same bacteria that caused the famous Black Death in Europe centuries ago. Fleas infestation can occur in homes, office, farm, and other environments. So the method we use today is also depending on whether we are dealing with pets, livestock, or wild animals. So one natural way to manage fleas is through biological control. This involves natural enemies. We can use parasitic wasps, which lay their eggs inside the flea larvae. So this can prevent them from developing into the adults. And there is another option by using the microbial agent like Nosoma protozoa, which infect and kill the flea population without harming the pets or the human. But for more immediate result, the most common one, we can use the chemical control methods. This is include insecticide and repellents that kill fleas at different life stages. And these are available in various forms, such as sprays, powders, and spot-on treatment for pets. For control and prevention continue. As with many pest problem, prevention is always better than cure. So how we can reduce the risk of flea infestation? Maybe we can start with the regular cleaning by washing the pet beddings, vacuum the carpet, and keep the living spaces clean to remove the flea eggs and the larvae. Next, maybe we can start the routine pest monitoring. We check the pets and the environment frequently because this can help to catch the infestation before they become severe. And last but not least, we can start to restricting pets in the sensitive area, keeping the pets out of office or maybe from the food preparation area to reduce the spread of the fleas. Today I would like to share one of the real life case study, a flea outbreak in the office setting. So this incident took place in the Setia Alam, where a sudden infestation led to widespread health concern among employees and also their families. So after several investigations, the culprit behind this outbreak was identified as Tenocephalidus felis. This is commonly known as a cat flea. And this species is a well-known ectoparasite. So it caused irritation and discomfort among the employees. In total, the infestation of this case has affected 41 staff members and 13 family members, and this case lead to widespread discomfort and allergic reaction. So to address the outbreak, several specialized units were involved. This include the Occupational Health and Safety Unit, Institute for Health System Research, Medical Entomology Unit and Acarology Unit, and also the Health District of Petaling. A comprehensive integrated pest management approach was also adopted to eliminate the infestation to prevent the recurrence. This control measure will consist of indoor residual spray, hot steaming vacuum, enhanced sanitation protocols. This include deep cleaning at the office space and also intensified surveillance. So as you can see from the slide, there are real cases of biting from the flea. You can see the red spot and swollen at the lower legs and ankles. And this is the picture from the activities that we conducted during the investigation. We placed the modified light trap, and also we examine the dead rats from the area. They also conduct deep cleaning and hot steam vacuum at the area to clean any immature stages of flea. And the response team, including entomologists, health workers, and health officers and safety personnel that work together to control the flea outbreak in Setia Alam office. The team conducted thorough inspection, insecticide spraying and sanitation procedures to eliminate the infestation. And they also wear protective gear to ensure safety during the operation. Their collaborative effort was crucial to restoring a safe and pest-free environment. For the takeaway message, to close my presentation, please take note that fleas are more than nuisance. They can disrupt life and spread the disease. Awareness, prevention, and quick action are key to controlling infestation. I would like to thank the Director General of Health, Ministry of Health, and Director of IMR for granting permission to present this study, and Dr. Nurul Atira Nasruddin for her input, and last but not least, the medical entomology staff for their invaluable assistance and dedicated effort to support all aspects of this work. And to all Muslims, selamat berpuasa. Thank you. Back to you, Dr. Khadri.
Thank you, Ms. Roziah Ali. So this was a very serious, tiny, blood-sucking insect. However, we move to next presenter, next speaker. If anyone has questions regarding the presentation, please feel free to submit them using the link provided in the YouTube channel. We now move to our second speaker. She is Ms. Amalina Kamarudin, a research officer in Medical Entomology Unit. She has been in the unit since early of COVID time, conducted several studies on biting midge and cockroaches. For today's webinar, Ms. Amalina will present her presentation on this Leptoconops or biting midge at the beaches, the biologies, and the implication. Ms. Amalina, the screen is yours.
Thank you very much, Dr. Khadri. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to everyone. Today, I would like to talk about Leptoconops, understanding its biology and pest implications. What is Leptoconops? Leptoconops is a genus of a tiny blood-feeding insect, commonly known as biting midges in the family Ceratopogonidae. Leptoconops are from kingdom Animalia, phylum Arthropoda, class Insecta, order Diptera, and family Ceratopogonidae. The size of Leptoconops are very smaller than mosquito. Where can Leptoconops be found? They are commonly found in tropical and subtropical regions, thriving in moist environments such as coastal areas, wetlands, mudflats, as well as near lakes, rivers, and ponds. They prefer areas where larvae can develop in moist sandy shore. In Malaysia, only one species, which is Leptoconops spinicifrons, has been found on the sandy beach of Bagan Lalang in Selangor, Pulau Au and Pulau Besar in Johor, as well as Tenggol A Island and Tenggol Bil Island in Terengganu. There were many Leptoconops species in moist environment, such as Leptoconops bequati, were found close to the sea in unshaded white sand at Caribbean and Florida. Leptoconops curtesi were found in first centimeter of the shallow moist sandy shore in the coastal areas of Grosseto, Italy. And Leptoconops chaquensis were found in forest area in Chaco province, Argentina. Leptoconops noi were found near riverside composed of sandy matter in northern Spain. These pictures show the habitat of Leptoconops spinicifrons at Bagan Lalang Beach, Selangor, Pulau Au, Johor, and Pulau Besar, Johor. For morphological characteristic of Leptoconops spinicifrons, the size range from 1 mm to 2.2 mm. They have white wings, they have pearl-colored abdomen, and turn to ruby red when blood fed. They have proboscis to suck the blood. For male abdomen has dark color at terminal segment of body, while female abdomen consists of creamy white lamella with pale hairs and 2 spermatheca. Life cycle of Leptoconops involve 4 stages, which are egg, larvae, pupa, and adult. The life cycle occurs in moist environments such as moist soil or sandy habitat before emerge to adult. Only females feed on blood from humans and animals for egg reproduction, while males feed on nectar. The biting activities of Leptoconops from dawn to dusk. There are several impacts infestation of Leptoconops, such as nuisance. Nuisance of Leptoconops may cause a serious public health problems. Their painful bite cause itching and irritation. The itchiness can be persistent and may recur for up to 3 weeks. Some people may develop hypersensitivity reactions, and scratching may lead to secondary infection or permanent scarring. The infestation also can give impact on outdoor activities, especially at the beach. And the infestation also can prevent the development of tourism associated with beach and are considered an important detriment to economic development. This picture shows biting of Leptoconops on legs, red bite marks on leg, and red bite marks on neck. Preventing and controlling the Leptoconops infestation involve reducing breeding sites such as sandy beach by using larviciding with pyrethroids. Using repellent consists of DEET, which 10% of DEET can give 100% protection for 1 hour and 20% of DEET give 100% protection for 2 hours. For personal protection, can wear protective clothing such as long sleeve shirts, long pants, and hat. And avoid being outside during early morning and late afternoon when the Leptoconops active at that time. In conclusion, Leptoconops are tiny insects but have significant pest implications due to their painful bites. Their painful bites cause discomfort, allergic reactions, and can impact outdoor activities, tourism, and agriculture, especially at the beach. Understanding their biology is crucial for effective management, such as habitat control and personal protection. More research is needed to mitigate their impact. Thank you very much to Dr. Ami Fazlin, the Director of IMR, for permission to talk about the Leptoconops today. And thank you for SEAMEO Network Malaysia IMR for giving me the opportunity to present today's webinar, especially and a big thanks to Dr. Muhammad Khadri bin Shahar, Head of Medical Entomology Unit, and to all Medical Entomology Unit staff for all their support. Thank you very much. Thank you, Dr. Khadri. I pass to you.
Okay, thank you, Ms. Amalina. That second tiny blood-sucking insect is really itchiness, long-lasting itchiness, and affected the tourism industry in the beaches. So we go to next speaker. Next speaker, we have here Ms. Rezki Sabrina Masse, who is also research officer in Medical Entomology Unit. She has been with us since 2018. She experts in charge of malaria parasite detection in Anopheles mosquito or nyamuk tiruk, and actively working on it, and currently on Leishmaniasis vector as well. Today, Ms. Rezki will be sharing with us presentation entitled From Biology to Control, Insights into the Sandfly Vectors of Leishmaniasis. Ms. Rezki, please, I pass it to you.
Thank you so much, Dr. Khadri, for the kind introductions. Assalamualaikum and a very good morning to all participants of the IMR webinar, both from Malaysia and beyond. It is truly an honor to be here today to share insight into a tiny yet a significant insect, the last sucking blood insect for today, which is the sandfly. Despite their small size, these insects play a major role in public health as a vector of several serious diseases. Today, we will explore their biology, life cycle, medical importance, and strategy for controlling them. So basically, this is the overview of my presentation today. For introductions, Barbertamine sandflies are a small insect, typically in 1.5 to 3.5 millimeter in size, and as compared to a mosquito, it's smaller compared to mosquito and a slightly bigger compared to a beating midge. Okay, and they are usually in brownish, golden, or grayish color. So as for movement, they are different with mosquitoes because they are weak flyer, and they also exhibit a characteristic hopping of short flight pattern rather than a continuous fly like a mosquito. Generally, they do not disperse more than a few hundred meters, but can move up to 2 kilometers over a period of several nights. Okay, and from the picture, basically, Barbertamine sandfly is a hairy appearance insect. Okay, they have a long, narrow wings that are held upright at a V shape over their body when at rest. So this is a special characteristic of the sandflies. And they also love to taking blood during a night time. Okay, and they're active also during from dusk and dawn. Okay. And both the female and male are taking a sugar from a nectars, but only female sandfly bites as they need a blood for egg development. As for the bites of sandfly, they often are painful and can cause red and itchy welts. Okay. And for habitat preference, they are thrive in the humid, organic, rich environments near human dwelling and animal shelters, commonly found in the forest ecosystem. For example, in the termites hills, in the tree holes, and also in the cave, like limestone cave, and then rodent or animal burrows, and under the stone or foliage, and also in the human settlement. Okay, this Prabaterma sandfly also widespread across the tropical and subtropical regions, and some are reported in the temperate region also. And the vector importance of this sandfly is these sandflies are known and famous for their as only confirmed natural vectors of leishmaniasis. Apart of that, they're also capable to transmitting other pathogens. Okay, so this is the life cycles of Prabaterma sandfly. They consist of 4 stages. Okay, this is the eggs. Okay, the eggs laid in the moist or organic rich environment. Okay, in contrast to mosquito and other diphtheria, sandflies do not have an aquatic stage in their life cycle. Still, humidity is an important factor, together with temperature, for the development of the sandfly. The larvae passes through 4 instar stages, feeding on also on organic matter, and then they become a pupa, a non-feeding stage, which is transitioning to adulthood, and lastly, they become adult, which is only female searching for a blood for the eggs development. Okay, and also the male can be differentiated easily under the microscope, because the last segment of the abdomen you can observe the genitalia. Okay, the ability to complete their life cycle in hidden and undisturbed environment makes them challenging to control. So we go to the external morphology of the Prabaterma sandfly. So as you can see, it's very hairy insect. Okay, you can see in their head, thorax, wings, abdomen. We can say all over the body. Okay, so these insects belongs to the subfamily of Prabaterminae. Okay, we look at the head. The head, you can directly see a very large, prominent, and black eyes. Okay, and a very long antenna, and a very saggy median proboscis. Okay, and then the thorax is very hairy and humpback. Make sure it's humpback. It's obvious and a special characteristic of a sandfly. Okay, and the legs, it's very long and slender, hairy, and this proportionate to the size of the body, which is adopted for the hopping or jumping of the sandfly. Okay, and the wing is have a characteristic of lanceolate in outline with a tapering end. And then the abdomen consists of 10 segments covered with hairs. 8 segments are visible, and the last 2 segments are modified into a genitalia, where in male there is a style, while in female there's a segment called a cerci. Okay, so we proceed to the medical importance of Prabaterma sandfly. Okay, Prabaterma sandfly is known as the only natural vector can transmit the leishmaniasis disease. So leishmaniasis disease is a parasitic disease caused by Leishmania parasite, transmitted by the bites of infected Prabaterma sandfly. Okay, there is three forms of leishmaniasis, which is the cutaneous leishmaniasis, which is its most common form of leishmaniasis, causes skin ulcer, as in the picture. And then second is the mucocutaneous leishmaniasis, which is the affects the mucosal tissues, like in the nose, okay, and the mouth part. And then lastly, the most severe form of leishmaniasis caused by the Leishmania donovani, which is a visceral leishmaniasis, okay, or also known as Kala-Azar. There is two species from this Leishmania donovani complex that are affected humans. Okay, number one is the Leishmania infantum. Leishmania infantums are more anthropozoonotic, which is can be transmitted from animals to humans, or from directly from human to human also, but more are largely anthropozoonotic. So this is more complex because they have interplay between variety of vertebrate, for example, like dogs, a rodent, a cat, or other animals lah, like tiger also. Okay, and then lastly, species of Leishmania donovani, which is largely anthropozoonotic because it's only a transmission between human and human. And then within the subfamily of Phlebotominae, three medically important genera are the Phlebotomus, Lutzomaya, and Sargentomaya, because all of these three genera are proven to bite human. Okay, and then for the Leishmaniasis vector species that have been confirmed to transmit the disease to the humans is Lutzomaya longipalpis, which is a vector of Leishmania infantum in the Americas area, largely in the America area. And secondly, the Phlebotomus papitaceae, which is a vector of Leishmania major in North Africa, Middle East, and Asia. And thirdly, Phlebotomus sargentii, which is a vector of Leishmania tropica in North Africa and Middle East. And next is the Phlebotomus argentipus, which is primary vector for Leishmania donovani in South Asia and India. And lastly is the Phlebotomus stantonii, which is a very potential vector in Southeast Asia. And the role is need to be more explored. Okay, for all the audience informations, for your own informations, Phlebotomus argentipus have been found abundance in the peninsula of Malaysia. Conducted a study from Dr. Khadri in 2011. Okay, and this species also proven bites human in some of the places in Peninsula Malaysia. Okay, and then the life cycle or the development of the parasite inside the sandflies are strictly developed inside the digestive tract of the sandfly, or in the midgut, okay, of the sandfly. It's very complex, okay, of process, okay, and then up until they become a very effective stage of parasite, metacyclic promasticode, which will infect to the next vertebrate host. Okay, a part of leishmaniasis disease, Phlebotomus sandfly also can carry different pathogens like bacteria and viruses as well, a part of parasites. For example, here is Carrion's disease, which is caused by bacteria called as Bartonella bacilliformis, which is the symptoms is called, you have a symptoms of Roziah fever and Peruvian warts, which is a cutaneous lesions. You can see at the picture, it's like a black lesions. Okay. And then thirdly, a Sandfly fever, which also known as a papatasai fever. It's caused by flavivirus virus, okay, genus. And then typically this disease will cause you a mild fever, but for some viruses like Toscana virus can cause a more severe neurological condition like meningitis and encephalitis. Okay, and even without the disease transmissions, the bites of Fabertaman sandflies can cause severe irritations and allergics in sensitive individual due to this sandfly bites. Okay, and then with no human vaccine against Leishmania parasite is available yet. Thus, the most effective strategy for controlling transmission remains the avoidance of vector bites or killing the vector itself through the implementations of integrated vector control measure. Okay, by using a chemical control. Okay, for example, the IRS can be using IRS or bed net to combat the indoor sandfly vector, and for the outdoor indoor vector, we can use a spraying technique. Okay, method. Okay, and then of course, the most effective way is to prevent. Okay, prevents are better than cure. So avoid the peak activity hours. Okay, stay indoor from dusk to dawn when sandfly are most active, and then use insect repellent if you are needed to go outdoor or you want to do the outdoor activity. So choose repellents containing DIDs or picaridins to expose skin, and especially during the peak sandfly activity. Okay, and then wear a protective cloth, wear a long sleeve shirt, long pants and socks to minimize the exposed skin, and then tuck in your pants into socks to prevent bites on the ankle. And lastly, you can also modify the environment by using a fan indoor to deter the sandfly, as they are weak flyer and dislike air currents, and keep windows and doors screened to prevent entry. And lastly, as a conclusion, Sparberthermine sandfly are tiny but a dangerous vector because they can carry 3 different pathogens like the parasite, virus, and the bacteria, which is a serious disease. And then effective controls require a combination of surveillance, biological and chemical intervention, as well as the personal protections. Strengthening our understanding of this vector will aid in developing better strategy of disease prevention. Therefore, we need a more or further study of this insect, especially in Malaysia, because this insect, or basically the disease that the insects can carry are more emerging. Okay. And with that, thank you so much. Thank you for your time, for listening. If you have any questions or would like to collaborate in the future, please contact me through my emails. Okay. With that, thank you, and I pass to you, Dr. Khadri.
Thank you, Ms. Rezki. Thank you very much for the presentation. We will now be moving to Q&A session. Okay, please do not hesitate to send us your questions using the link provided in the YouTube channel. There's so many questions out there. I'll try to my best to connect you to the speakers through the posted question. However, should you should the time does not allow us to address all the questions, our speaker will try their best to answer the question through emails. To Amalina, the first question to Amalina. Miss Amalina from Siti Nur Azizah, live chat YouTube. Okay, does Leptoconops found widely in Malaysia?
Okay, thank you, Siti Nur Aziza, for the questions. Leptoconops are commonly found in beach area or coastal area. No studies confirm the distribution of the Leptoconops in Malaysia, but the previous study that has been investigated that Bagan Lalang, Pulau Au and Pulau Besar in Johor has Leptoconops spinifrons. That's all.
I think Miss Amalina, I think at Langkawi have a lot of beaches. I think there's a lot of beaches that, however, there's no Leptoconops over there. There was a study in 2005. And yes, most of the over there, they love to stay in beautiful sandy beaches in East Coastal. So yet to confirm in Sabah and Sarawak, Borneo area. So perhaps Malina will do the study over there and announce it to Malaysian. Okay. Next question. Next question, we move to whom? For Miss Roziah, the flea outbreak. This question from Siti Noraziza. The flea outbreak in Setiala was caused by a cat flea. Do we need to be cautious when petting the stray cats? Roziah.
Okay, thank you, Doctor, and thank you, Siti Noraziza. Yes, the flea outbreak in Seti Alam, we confirm that the culprit is the Tenucepalides felis felis. This is known as a cat flea. And the second question is,
can you have your question again, right? Yeah.
do we need to be cautious when petting the stray cat? Yes, because stray cats is easily get infected by the flea, because flea is easy to because we don't the stray cat, they don't have any protection, and yes, need to be cautious when you petting the stray cat, and sometimes the flea, they can jump and to the new host, and please be cautious for stray cat and also dogs.
Ms. Roziah, subsequently after that petting the cats, so I have been my childhood, I have up to 13 cats at one time. There are fleas there at my cats there. However, they never bite us. And how can this flea become brutal in certain situation? Can you explain to us?
The flea became brutal. There are several factors. Some of it is maybe because of the host is no longer available, the absence of the host. So the flea will try to look for the alternative host. So when the nearby host is human, so human, even though the species is is cat flea, they will also can bite the human. So the alternative host is also the factor because it's nearby from the dead cat.
Okay, seems that they're jumping.
Yeah,
Once
because they can jump.
when the host going to sick or died or overpopulated, they will jump out and find the new host. That is dangerous about these fleas. Okay, we move to Miss Rezki. SIM leishmaniasis disease is very new to many of participants or viewers. Is this leishmaniasis really new to Malaysia? From Jamal.
Okay. Okay, Doctor. Thank you for the questions, Jamal. Okay. Actually, leishmaniasis disease is endemic disease in 98 countries worldwide, but in Malaysia, we we only have imported cases since 1999, which is coming from immigrant workers during that time, and also we have in 2006, if I'm not mistaken, reported of leishmaniasis cases in Aboriginal populations in Malaysia. And part of that, we only have imported cases as for now. Okay. I think it's only that's Dr. Khadri.
Okay, thank you, Ms. Sabrina. Okay, so from Dr. Lee Han Lim. Dr. Ali, thank you for watching us. How are you? Okay, so your question, did we screen for Aropochi virus in colicoides? This virus was lately reported infecting humans in many South American countries. So I want to answer the question. Amalina? Yeah. Okay, Amalina, pass it to me back. Okay, colicoides, there's no takers from our researcher, even the researcher to be, because colicoides seems the mildest insects that can cause disease, transmit diseases. However, we do aware about these colicoides that species, particularly Colicoides palaniensis, is not available in Malaysia. That species, the palaniensis, the Colicoides palaniensis is the one who causing the transmitting the Oropochi viruses in South Africa, South America. So far we yet to consider, we yet to receive any specimen, but we aware about this. Anything we are ready. Our team are ready to screen for Oropochi. We are looking now for the primers, and we are standby for it. Anytime, if any outbreak of Oropochi, hopefully not in Malaysia, because I don't think that colicoides can fly away from here to Malaysia unless somebody brought it the eggs or whatever. So thank you, Dr. Lihan, for the question. Okay, the next question to Amalina. How this people said we can use oil. Yeah, Mr. Faisal from Faisal Hamdan said that how oil can control or can it kill Leptoconops, because seems that Faisal Hamdan know about this oil application. Is it work, Ms.
Okay.
Amalina?
Thank you very much to Faisal Hamdan for the questions. Okay, yes, we can use oil to kill the Leptoconops. When natural oils are applied to our body, the Leptoconops which land onto the body parts will be trapped and subsequently be killed. This is because of the oily layer on the body parts can wet the lower abdomen of Leptoconops, so it will block the spiracles, and this will prevent their ability to breathe. So many Leptoconops will be trapped by using this oil, such as olive oil, castor oil, or citronella oil, and resort owners also can promote this method lah. It really works.
Thank you, Ms. Amalina. That's oily base, castor, not castor oil. Please
Castor oil.
be careful. Castor and castor, two different things. Castor oil, or in Malaysia we call it minyak jarak. Okay, we now go to Ms. Rezki. This question from Khadri. Exactly of which habitat the Sandfly, this pulverteman fly, can be found, and at what time they normally active? Ms. Rezki.
Okay, thank you, Doctor. Thank you, Khadri, for the questions. In general, they can found in the forested area, cave, and human settlement. Okay, they have a very diverse habitat, but in Malaysia, in our experience, we are collecting abundance of sandfly in limestone caves, and also in the forested area, whereas have under the big stone, they are humid and moist with organic matters, or in the tree trunk in the forest as well, and at the tree hole also. Okay, and at what time? Of course, this in the day, these sandflies are usually resting in a very dark area and cover area. But if they are only active after sunset until before sunrise. So basically, they are active throughout the night, but they're more. They have a study said that found that they are more active at the early morning time. Okay, around 1 and 2 a.m. Okay, and I think I answered all the questions. Dr.
Okay, thank
Khadri.
you,
Yeah.
Ms. Rezki. Okay, we now go to back to Roziah, Miss Roziah. So from Mohaimin, the question is: after vacuum, how house or premise owner can ensure the adults, eggs, and pupae of the fleas in the vacuum bag can be destroyed?
Thank you, Doctor, and thank you, Mr. Mohaimin. So sometimes after vacuum, so after we use vacuum to clean the infested area or our carpet, sometimes we can get the adult, egg, and the immature stages of the flea in the vacuum bag. So to make sure the immature stages is completely and clearly clean from the infested flea, we can seal and treat the vacuum bag before we throw it away. And please make sure if the vacuum bag is some vacuum they don't have any bags, so make sure you clean it up and maybe wash the canister of the vacuum. I think the best way is to seal the vacuum bag before you throw it away and treat the vacuum bag with the insecticide. So we can make sure there's no left of the flea, because as we mentioned before, the immature stages is very dangerous, because once they have the right condition, the right environmental condition, they can emerge and start a new infestation. So that's all from me, Doctor.
Thank you, Puan Roziah, Miss Roziah. Now we go back to Puan Rezki or Miss Rezki, Sabrina. Can sandfly be controlled easily by public?
Okay, thank you, Dr. Khadri, and thank you, Miss Hanani, for the questions. Public need to understand where is the habitat of this sandfly. Okay, like I said before, it's abundance and many in limestone cave. If you are visiting limestone, you have to prepare yourself by wearing a proper protections or repellents, or wearing full covered t-shirt and pants to avoid from bites of this sandfly. Okay, because you cannot see this sandfly. They are almost, you cannot see from using a naked eyes. It's very small. So what you can do, what you can control is prepare yourself when you go to the habitats. Okay, so as a public, they can always bring their repellents and always reapply their repellents whenever they go to the forest area, the limestone cave area. Okay, just make sure you are not expose your skins to that, to those area lah. Thank you, Doctor.
Okay, this another question from Chin Yun Khan, UKM. Thank you, Chin, for viewing our YouTube channel. The question is posted to Puan Roziah, Miss Roziah. Is there any screening test such as dengue rapid test kit to confirm the infection? Miss Roziah.
Thank you, Dr. Khadri and Mr. Chin. This is screening test for the plague, I guess, perhaps.
Dengue.
For the for the disease that transmit by the flea. So as far as we know, there is no screening test. But I think I need to reconfirm. Is there any screening test for the disease that transmitted by the flea, Dr. Khadri?
Thank you. Thank you, Ms. Roziah. So far, nobody, not us, developing the screening rapid test for this fleas infection. So maybe one day, maybe there's available in market, but not with us at the moment, not with IMR. When IMR did not provide this service. So the next question, okay. Next question. Next, okay. Yeah, this next one from Amalina. This is my question for Amalina. So this Leptoconops, do they have season biting public at the beaches? Any season?
Okay. Thank you, Dr. Khadri, for the question. There will be Leptoconops in all season. However, in rainy day, Leptoconops will hide about 1 foot in soil.
Okay. So, season. So we're talking about season. Maybe that's the answer should be season. We have Malaysia have 2 seasons: raining and hot season. So when rainy season, there's very much less or none biting midge at the beaches. Except at the hot season, they will emerge out from the sand and try to find the bloods on the publics. Okay, we move to a question from Encik Husaini, Sekolah Kebangsaan Damansara Damai. Posted to Puan Roziah. Mr. Roziah, which insect are the most dangerous?
Thank you, Dr. and Mr. Husaini from Sekolah Kebangsaan Damansara Damai. I think this is a very general question. Which insect are the most dangerous? If I want to answer that question, the most deadliest insects are mosquitoes, because mosquito they can transmit a lot of disease such as dengue, malaria, and also other viruses. So that is my answer, Dr. Khadri. But if you want to ask from the insects, from the tiny insects, I think Dr. Khadri can answer.
Okay, from these 3 tiny insects, so the most dangerous one, the most cause death or harmless to human. The number represent the dangerous level. So as you know, fleas is not yet dangerous in Malaysia, but it's yet to come maybe. We do not know. History will be repeat. Okay, secondly, Leptoconops, this only implication on the tourism industry at the beaches. Okay, this phlebotoman flies. The phlebotoman flies only leishmaniasis. They can be treated if treated early. Otherwise, you will losing leishmaniasis cutaneous. You will losing your ears, nose, mouth. So there's a pro and con depend on the country and location. So again, let's agree with Roziah. Dengue, mosquito is the most dangerous because it's caused to Malaysia a lot of death. Death is very serious. Everybody should not take note of this to take care their compound. As Minister always remind, always spend your time 1 hour every weekend to make sure your compound are safe from Aedes breedings. So we move to question from Dr. Tan to posted to Ms. Rezki. What criteria must be met to eliminate a Sandfly species as a vector, and is detecting the parasite in Sandfly alone sufficient for vector incrimination? Rezki.
Thank you, Doctor, for the questions. Thank you, Dr. Tan, also for the questions. Okay, there is 4 criteria. Okay, number 1, the sandflies need to be proof fit on humans. The anthropophilic behavior of that sandfly need to be proven. Okay, number 1, and then number 2, this sandfly also feed on the relevant reservoir host in the case of zoonotic agents. And then number 3, they are found in the nature infected with the same parasites circulating in humans as well as in the animal host. Okay, and then they also support the complete development of the Leishmania parasite circulating in humans, including after the defecations of the blood meal remnants. Okay, and lastly, they're able to transmit those parasites to susceptible hosts. Okay, and that's why the second questions whether detecting using a molecule it's sufficient. Of course, it's not sufficient because the parasite inside the Leishmania parasite inside the sandfly can support the cycle of parasite in the human as well. So before the after the defecations of the blood meal, even after the defecation of the blood meal. So if you detect the positive parasite inside the engorged sandfly, it's not yet to be confirmed as a vector. So you need to see also whether the parasites complete the cycle until to the promastigot. Okay, I think that's
Okay, thank you, Ms. Rezki Sabrina, for in-depth explanation. Okay, I'm afraid that is all the time we have for Q&A session. Any additional question will be answered by the speaker. Through emails. We hope that this webinar has shed light on some research work that we are conducting in IMR and will spark interest and could initiate research collaboration with others. Ladies and gentlemen, now we have come to the end of the webinar session. I would like to thank all the participants out there for their support to make this session successful. Don't forget to subscribe to our National Institute of Health Malaysia YouTube channel. Before I conclude, I would like to announce that we have next webinar session of IMR webinar with SEAMEO. The title is Advancing Cell and Gene Therapy on the 25th April 2025. So mark your calendars. I would like to also take this opportunity to wish Ramadan Kareem to all Muslims who will be welcoming the fasting month tomorrow or this weekend. This is all from us for now. Take care and stay safe. Thank you.